Welcome back to Leo English Podcast. Hello, everyone. Thanks for spending your time learning English with us.
I'm Leo. Hello, friends. We're glad you're practicing English with us today.
And I'm Tina. We're here to help you improve your conversational English in a natural and fun way.
Exactly. And today we have a really important topic. We're going to teach you how to talk at the hospital in English. We'll cover 100 essential phrases you might need.
This is so useful because hopefully you never need it, but if you're traveling in an English-speaking country, living abroad, or even helping a friend or family member, knowing these phrases can really help you feel more confident and less stressed.
Yes, hospitals can be scary places, especially if you don't speak the language well. So we want to prepare you.
If you find this lesson helpful, please give us a thumbs up and subscribe to our channel. It really helps us continue making these videos for you.
All right, let's get started.
So, Leo, how are you today?
I'm doing pretty well, actually. A little tired, though. I stayed up late watching a movie last night.
Oh, really? What movie?
It was an action movie. Lots of explosions and car chases. You know, the usual stuff. What about you? How was your weekend?
My weekend was nice. I went hiking with some friends on Saturday. The weather was perfect, sunny but not too hot. And on Sunday, I just relaxed at home, read a book, did some cooking.
That sounds lovely. Much more peaceful than my weekend. I actually had a small accident.
Oh no, what happened? Are you okay?
I'm fine, don't worry. I was playing basketball with my friends, and I twisted my ankle a little bit. Nothing serious, but it hurt for a while.
Did you go to the doctor?
No, it wasn't that bad. I just put some ice on it and rested. But it made me think about how sometimes we do need to go to the hospital or see a doctor, especially if we're in a foreign country.
That's actually perfect timing because that's exactly what we're talking about today.
Right. Speaking of hospitals and medical situations, let's teach our viewers how to handle these situations in English.
Okay, so Leo, have you ever been to a hospital in an English-speaking country?
Yes, actually. I went to a hospital in the United States a few years ago. I had a really bad stomach ache, and I didn't know what was wrong.
Oh, wow. That must have been stressful. Were you nervous about speaking English there?
Absolutely. I was really nervous. But the good news is that the hospital staff were very patient and helpful. They spoke slowly and clearly when they saw I was struggling a bit.
That's good. So let's imagine a situation. You're not feeling well and you need to go to the hospital. The first thing you need to do is go to the reception desk, right?
Right. The reception desk is where you first check in. It's usually near the entrance, so when you walk in, you look for a desk with people sitting behind it.
Exactly. And what do you say when you get there?
Well, you can say something simple like, "Hello, I need to see a doctor," or, "Excuse me, I need some help."
Perfect. Those are great starting phrases. You can also say, I'm not feeling well, or I think I need medical attention.
What does medical attention mean?
Medical attention means care from a doctor or nurse. It means you need someone to look at your health problem and help you.
Got it. So if someone has a serious problem, they might say, "I need medical attention immediately."
Exactly. Now, the receptionist will probably ask you some questions. They might ask, what's the problem? Or what brings you in today?
Oh, that's a common question. What brings you in today? It's a polite way to ask why you came to the hospital.
Right. So you need to explain your symptoms. Symptoms are the signs that show you're sick or injured. For example, if you have a fever, that's a symptom. If you have a headache, that's a symptom.
So you might say, "I have a terrible headache," or "I've been vomiting all morning."
Yes, good examples. You can also say, I have a high fever, I have chest pain, or I hurt my arm.
What if you don't know the exact word for your problem?
That's a great question. You can describe it. For example, you can point to the area and say, it hurts here, or this part of my body feels strange.
That's really helpful. I remember when I had that stomach ache, I said, "My stomach really hurts," and I touched my stomach area. They understood immediately.
Perfect. Body language helps a lot. Now, after you explain your problem, the receptionist will probably ask for your personal information.
Right. They'll ask for your name, date of birth, and address. They might say, "Can I have your name, please?" Or, "What's your date of birth?"
And you should answer clearly. For your name, you can say, "My name is," or just say your name directly. For your date of birth, you can say, "It's January 15th, 1990," or "I was born on January 15th, 1990."
What about address? Sometimes that's tricky if you're traveling.
Good point. If you're staying at a hotel, you can say, "I'm staying at the Grand Hotel on Main Street," or "I'm a tourist and I'm staying at." They'll understand.
Okay, and they'll probably ask about insurance too, right?
Yes, definitely. They might ask, "Do you have health insurance?" or "Do you have insurance information?"
Insurance is so important. It's the system that helps pay for medical care. If you have travel insurance, you should bring those documents.
Exactly. You can say, "Yes, I have travel insurance," and show them your insurance card or documents. If you don't have insurance, you should be honest and say, "No, I don't have insurance. I'll pay out of pocket."
What does pay out of pocket mean?
It means you'll pay with your own money, not through insurance. It comes from the idea of taking money out of your pocket.
Ah, I see. That makes sense. So after you check in at reception, what happens next?
Usually, they'll tell you to wait in the waiting room. They might say, "Please have a seat in the waiting area," or "Someone will call your name soon."
The waiting room can be a little boring. You might wait for 10 minutes or sometimes even an hour, depending on how busy the hospital is.
That's true. While you're waiting, a nurse might come out and call your name. They'll say your name out loud, like John Smith, or "Is Sarah Johnson here?"
So you need to listen carefully for your name. When you hear it, you stand up and say, "Yes, that's me," or just say, "Here."
Right. Then the nurse will take you to a room. This might be an examination room or a triage area. Triage is where they check how serious your condition is.
In the triage area, the nurse will check your vital signs. What are vital signs?
Vital signs are basic health measurements like your temperature, blood pressure, and heart rate. The nurse might say, "I'm going to take your temperature," or "I need to check your blood pressure."
And you just sit still and let them do it. They'll put a thermometer in your mouth or ear for temperature, and they'll put a cuff around your arm for blood pressure.
Exactly. They might also ask you to describe your symptoms again in more detail. They might ask, "When did the pain start?" or "How long have you been feeling this way?"
Those are important questions. You should try to be specific. For example, "The pain started yesterday morning," or "I've been sick for 3 days."
Good. They might also ask, on a scale of 1 to 10, how bad is the pain? This helps them understand how serious it is.
Right. 1 is very little pain, and 10 is the worst pain you can imagine. So you might say, "It's about a 7," or "It's really bad, maybe a 9."
After the nurse finishes, they'll probably say, "The doctor will be with you shortly," or "The doctor will see you in a few minutes."
Then you wait again in the examination room. When the doctor comes in, they usually introduce themselves first. They might say, "Hello, I'm Dr. Smith," or "Hi, I'm Dr. Jones. I'll be taking care of you today."
And you should greet them politely. You can say, "Hello, doctor," or "Nice to meet you, doctor."
The doctor will probably ask you to explain your problem again. I know it feels repetitive, but it's important. They might say, "So what seems to be the problem?" or "Tell me what's going on."
This is your chance to explain everything clearly. Start from the beginning. For example, "I woke up this morning with a terrible headache and then I started feeling dizzy."
The doctor might ask follow-up questions like, "Have you taken any medication?" or "Do you have any allergies?"
Allergies are very important to mention. If you're allergic to certain medications, you must tell the doctor. You can say, "I'm allergic to penicillin," or "I have no known allergies."
What if you don't know the name of a medication in English?
You can describe it or show them the bottle if you have it. You can say, "I take a small white pill for my blood pressure," or "I'm taking this medication," and show them.
That's smart. After asking questions, the doctor will probably examine you. They might say, "I need to examine your throat," or "Let me check your ears."
During the examination, they might use some medical tools. They might use a stethoscope to listen to your heart and lungs. They'll say, "Take a deep breath," or "Breathe normally."
A stethoscope is that instrument with the 2 earpieces and a round part they put on your chest. It looks like a Y shape.
Exactly. They might also press on different parts of your body to check for pain. They'll say, "Does this hurt?" or "Tell me if this is painful."
You should answer honestly. Say, yes, that hurts, or no, that's fine, so they know exactly where the problem is.
After the examination, the doctor will tell you what they think is wrong. They might say, "It looks like you have," and then give you a diagnosis.
What's a diagnosis?
A diagnosis is when the doctor identifies your illness or medical condition. They figure out what's wrong with you. For example, they might say, "You have the flu," or "It's just a minor infection."
Sometimes they're not sure right away, right?
That's true. If they're not sure, they might say, "I'd like to run some tests," or "We need to do some blood work."
Blood work means they'll take a sample of your blood and test it in a laboratory. They might say, I need to take some blood, or we'll need a blood sample.
If you're nervous about needles, you can tell them. You can say, "I'm a little nervous about needles," or "I don't like needles very much." They'll try to make you more comfortable.
They might also order other tests like x-rays or scans. They might say, we need to take an x-ray of your chest, or I'm ordering a CT scan.
After the tests, you might have to wait for the results. The doctor might say, "The results will take about 30 minutes," or "We'll have the results soon."
Once they get the results, the doctor will come back and explain them to you. They might say, the good news is, or unfortunately, the tests show.
Then they'll talk about treatment. Treatment is how they'll help you get better. They might prescribe medication or suggest other treatments.
If they prescribe medication, they'll give you a prescription. They might say, I'm prescribing antibiotics for your infection, or take this medication twice a day.
You should ask questions if you don't understand. You can ask, "How should I take this medication?" Or, "Are there any side effects?"
Side effects are unwanted reactions to medication. For example, some medications make you sleepy or upset your stomach.
Right. The doctor should explain how to take the medication. They might say, "Take one pill in the morning and one at night," or "Take this with food."
You can also ask, how long should I take this medication? They might say for 7 days or until you finish the bottle.
If they don't prescribe medication, they might give you other advice. They might say, "Get plenty of rest," or "Drink lots of water."
Those are common recommendations for many illnesses. Rest and hydration help your body heal.
Sometimes they'll schedule a follow-up appointment. They might say, "I'd like to see you again in 1 week," or "Come back if your symptoms don't improve."
A follow-up appointment is when you come back to see the doctor again to check on your progress.
Before you leave, make sure you understand everything. You can say, "Just to confirm, I should take this twice a day," or "So I should come back next week?"
It's always okay to ask questions. Doctors want to make sure you understand your treatment.
After you finish with the doctor, you might need to go to the pharmacy to get your medication. The pharmacy is usually inside the hospital or nearby.
At the pharmacy, you give them your prescription. You can say, I need to fill this prescription, or the doctor prescribed this for me.
The pharmacist will prepare your medication. They might say, "It'll be ready in 15 minutes," or "Please wait a moment."
When they give you the medication, they'll explain how to use it again. They might say, take one tablet twice a day with meals, or apply this cream to the affected area.
You can ask the pharmacist questions, too. They're very knowledgeable about medications. You can say, "Can I take this with my other medication?" Or, "What should I avoid while taking this?"
Finally, you need to pay. You go to the billing department or pay at the reception desk. They might say, your total is, and tell you the amount.
If you have insurance, you show them your insurance card again. If you're paying yourself, you can use a credit card or cash. You can say, "Can I pay by card?" Or, "Do you accept credit cards?"
After you pay, they'll give you a receipt. Keep this receipt because you might need it for insurance reimbursement later.
Reimbursement means getting money back from your insurance company for medical expenses you paid yourself.
Before you leave, you can ask, is there anything else I need to do? Or do I need any follow-up care?
They'll let you know if you need to do anything else. Then you can leave and go home to rest and recover.
One more important thing. If it's an emergency, everything happens much faster. You should know how to call for help.
Right. In many English-speaking countries, you call 911 for emergencies in the US, or 999 in the UK, or 000 in Australia. You should say, "I need an ambulance," or
This is an emergency.
An ambulance is the special vehicle that takes people to the hospital in emergencies. It has medical equipment and trained staff.
When you call for emergency help, speak clearly. Say your location first. I'm at 123 Main Street, or I'm at the Grand Hotel.
Then explain the emergency. Someone is having chest pain, or there's been an accident.
The operator will ask you questions. Stay calm and answer clearly. They're trained to help you.
In the emergency room, things move very quickly. The staff might seem rushed, but they're working hard to help everyone.
You might hear phrases like, "We need to act quickly," or "This is urgent." Don't be afraid. They're professionals.
Okay, I think we've covered a lot of situations, from checking in to seeing the doctor to getting medication and even emergencies.
Yes, we've talked about so many important phrases and situations. The key is to stay calm and communicate as clearly as you can.
You know, Leo, while we were talking, we used many useful words and phrases. Let's review some of the most important vocabulary.
Good idea. Our viewers need to remember these words because they're so essential.
First word, reception. Reception or reception desk is the first place you go when you enter a hospital or clinic. It's where you check in and give your information.
Yes, the reception is usually right near the entrance. You can say, "I need to go to the reception desk," or "Where is reception?"
For example, when I arrived at the hospital, I went straight to the reception. Another example, the receptionist was very helpful and friendly.
I always look for the reception desk first when I enter any building. It's where you get help and directions.
Next word, symptoms. Symptoms are the signs that show you're sick or injured. They're what you feel or notice when something is wrong with your body.
Right, like fever, headache, cough, or pain. These are all symptoms.
Exactly. For example, my main symptom is a terrible headache. Or, I've had these symptoms for 3 days now.
You can also ask, what are the symptoms of the flu, when you want to know what signs to look for.
Good one. What symptoms do you hate the most, Leo?
I really hate nausea. That's the feeling when you think you might vomit. It's so uncomfortable.
Third word, allergies. An allergy is when your body has a bad reaction to something like food, medication, or pollen.
This is super important to tell your doctor. Some allergies can be very dangerous.
Right. For example, I'm allergic to penicillin, so I can't take that antibiotic. Or I have seasonal allergies, so I sneeze a lot in spring.
Another example, do you have any food allergies? That's a common question at restaurants, too.
I'm allergic to shellfish, so I always have to be careful when I eat seafood.
Really? That must be difficult because shellfish is delicious.
Fourth word, diagnosis. A diagnosis is when a doctor identifies what illness or condition you have. It's the official answer to, "What's wrong with me?"
So after examining you and maybe running tests, the doctor gives you a diagnosis.
For example, the doctor's diagnosis was bronchitis, or I'm waiting for a diagnosis from my blood test results.
You can also say, the doctor diagnosed me with the flu, using it as a verb.
Exactly. It makes you feel better when you finally get a diagnosis, because then you know what you're dealing with.
Fifth word, prescription. A prescription is an official note from a doctor that tells the pharmacy what medication to give you.
You need a prescription for most medicines. You can't just buy strong medications without one.
For example, the doctor wrote me a prescription for antibiotics, or I need to fill this prescription at the pharmacy.
Another way to use it, this is a prescription medication, so you need a doctor's approval to buy it.
The opposite would be over-the-counter medication. That means you can buy it without a prescription.
Good point. Medicine like aspirin or cold medicine are usually over-the-counter.
Sixth word, examination. An examination is when the doctor checks your body to find out what's wrong. They look at you, touch certain areas, and use tools to check your health.
Yes, it's also called a physical exam or checkup sometimes.
For example, the doctor did a thorough examination and found the problem. Or, during the examination, the doctor checked my ears and throat.
You can also say, I have a medical examination tomorrow, when you have a scheduled doctor's appointment.
I always feel a bit nervous before examinations, even though I know they're important.
7th word, emergency. An emergency is a serious situation that requires immediate action, usually because someone's life or health is in danger.
Like a car accident, heart attack, or serious injury. These are all emergencies.
For example, this is an emergency, call an ambulance. Or, in case of emergency, dial 911.
Another example, he was rushed to the emergency room because of chest pain.
The emergency room, or ER, is the part of the hospital that handles urgent and life-threatening situations.
It's open 24 hours a day, every day, because emergencies can happen anytime.
10th word, insurance. Health insurance is a system where you pay money regularly to a company, and they help pay for your medical costs when you need care.
It's really important to have, especially in countries like the United States where medical care is expensive.
For example, does your insurance cover this procedure? Or, I need to check with my insurance company first.
Another example, my travel insurance paid for my hospital visit in London.
There are different types: health insurance, travel insurance, dental insurance, and more.
I always buy travel insurance when I go abroad. It gives me peace of mind.
11th word, medication. Medication is any drug or medicine that you take to treat an illness or condition. It's the official word for medicine.
Like pills, tablets, capsules, or liquid medicine.
For example, are you taking any medication right now? Or, this medication should help with your pain.
You can also say, remember to take your medication twice a day.
Some people use the word meds as a short, informal way to say medication, like, did you take your meds today?
Right, but in formal situations like at the hospital, it's better to say medication.
12th word, appointment. An appointment is a scheduled time to see the doctor or dentist. You arrange it in advance.
You can't just show up anytime. You need to make an appointment first.
For example, I have a doctor's appointment at 2 p.m. tomorrow, or I need to schedule an appointment with my dentist.
You can also say, can I make an appointment for next week when you're calling the doctor's office?
If you can't go, you should cancel your appointment. You can call and say, I need to cancel my appointment.
What if you're late to an appointment?
You should call ahead and say, I'm running late for my appointment. I'll be there in 15 minutes.
13th word, treatment. Treatment is the medical care you receive to cure or improve your condition. It's what the doctor does to help you get better.
Treatment can be medication, surgery, therapy, or rest. It depends on what's wrong with you.
For example, the treatment for my infection was a course of antibiotics. Or, what treatment do you recommend, doctor?
Another example, she's receiving treatment for her broken arm at the hospital.
You can also say medical treatment to be more specific.
The goal of treatment is always to help you recover and feel better.
14th word, recovery. Recovery is the process of getting better after an illness or injury. It's when your body heals and returns to normal.
Recovery can take days, weeks, or even months depending on how serious the problem is.
For example, my recovery from surgery took 6 weeks. Or, I wish you a speedy recovery.
That's a common phrase, speedy recovery. It means you hope someone gets better quickly.
You can also say, he's making a full recovery, which means he's getting completely better, back to 100%.
Recovery requires rest, proper medication, and sometimes physical therapy.
Okay, let's summarize all our vocabulary words. We learned reception, the check-in desk, symptoms, signs of illness, allergies, bad reactions to substances, diagnosis, identifying the illness, prescription, doctor's note for medication, examination, physical checkup, emergency, serious urgent situation, insurance, medical cost coverage, medication, medicine or drugs, appointment, scheduled doctor visit, treatment, medical care to heal, and recovery, getting better after illness.
Those are 12 really important words that you'll hear all the time in medical situations. Okay, Leo, that was a lot of talking about hospitals and medical situations.
Yes, it was. But I think we covered all the important parts. Our viewers should feel much more prepared now.
Let's think about what we learned today. First, we learned about arriving at the hospital and checking in at the reception. You introduce yourself and explain your symptoms. You use phrases like, I need to see a doctor, I'm not feeling well, and I think I need medical attention.
Right. Then you give your personal information, like your name, date of birth, and address. You also tell them about your insurance if you have any.
Second, we talked about the waiting room and what happens when the nurse calls your name. They take you to an examination room and check your vital signs. They ask questions like, when did this start? And how bad is the pain?
You need to answer clearly and honestly. Use phrases like, the pain started yesterday, or on a scale of 1 to 10, it's about an 8.
Third, we learned about meeting the doctor and explaining your problem in detail. The doctor asks questions about your symptoms, allergies, and medications. They perform a physical examination using tools like a stethoscope.
During the exam, you might hear phrases like, take a deep breath, does this hurt, and let me check your throat. You respond with, yes, that hurts, or no, that's fine.
Fourth, we discussed getting a diagnosis and possibly needing tests. The doctor might say, I'd like to run some tests, or we need blood work. After the tests, they explain the results and give you a diagnosis.
The diagnosis tells you what's wrong. Then the doctor talks about treatment options and might prescribe medication.
Fifth, we learned about prescriptions and going to the pharmacy. You say, I need to fill this prescription, and the pharmacist explains how to take the medication. They use phrases like, take 1 tablet twice a day, or take this with food.
You should ask questions like, are there any side effects? Or how long should I take this? To make sure you understand completely.
Sixth, we covered paying for your treatment and keeping receipts for insurance reimbursement. You ask, can I pay by card? And make sure to get all your documentation.
And finally, we talked about emergencies. You call the emergency number and say clearly, I need an ambulance, and give your location. In the emergency room, staff work quickly to help you.
The most important thing to remember is to stay calm and communicate as clearly as possible. Even if your English isn't perfect, doctors and nurses are trained to help you and understand you.
Exactly. And it's always okay to say, I don't understand, or can you explain that again, please? They want to make sure you understand your treatment.
See? When we break it down step by step, it's really not that complicated. You just need to know the right phrases for each situation.
Now we want to hear from you. This is our favorite part.
Our question of the day is, have you ever been to a hospital in an English-speaking country? What was your experience like? Or if you haven't, what medical situation are you most worried about when traveling abroad?
That's a great question. I'll answer first. As I mentioned earlier, I went to a hospital in the United States with a bad stomachache. I was really nervous about communicating, but the staff were so patient. They spoke clearly and made sure I understood everything.
That's wonderful. I've been to a clinic in London for a minor issue. I had a terrible cold and needed some medicine. The doctor was very professional and gave me good advice. It wasn't scary at all, actually.
See, we have different experiences, but both were positive, and that's okay.
So, viewers, we want to know about you. Have you had a medical experience in English? Or what are you worried about?
You can write something like, I went to a hospital in Canada and, or, I'm worried about explaining my symptoms in English because, or, I've never been, but I would be nervous about.
Please tell us in the comments. Write about your experience or your concerns. We really want to hear from you.
This helps us understand what topics you want to learn more about, and it helps us make better videos for you in the future.
And it also helps you practice writing in English, which is so important for learning, so it's good for everyone.
Don't be shy. There are no wrong answers. We love reading your comments.
Okay, we're reaching the end of today's lesson. Thank you so much for watching and learning with us today.
If you found this lesson helpful, please give this video a big thumbs up. It really helps our channel grow and lets us know that you appreciate our content.
And if you haven't already, please click the subscribe button and click the little bell notification icon.
That way, you won't miss any of our new videos. We post new lessons regularly to help you improve your conversational English.
You are all great students, and we're so proud of your dedication to learning English.
Keep practicing these phrases. Maybe write them down in a notebook or practice saying them out loud. The more you practice, the more natural they'll become.
Remember, it's okay to make mistakes. That's part of learning. Even if you don't say everything perfectly, people will understand you if you try your best.
And doctors and nurses especially are trained to be patient and understanding, so don't be afraid to ask for help or ask them to repeat something.
Exactly. Your health is the most important thing, so don't let fear of speaking English stop you from getting medical care if you need it.
All right, that's all for today's lesson.
We hope you learned a lot of useful phrases and feel more confident about handling medical situations in English.
Take care of yourselves and stay healthy. Goodbye.
Bye, everyone.